Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Beth Garrison. Beth is a family nurse practitioner with Planned Parenthood of the North Country, New York. Beth, welcome to North Country Matters. It's a pleasure to have you on the show to talk to us about some of the essential healthcare services Planned Parenthood offers here in the North Country. In particular, we're going to talk today about family planning and other related health services.
Thank you so much for having me.
Well, my pleasure. So we always ask new guests on the show to tell us a little something about themselves and how they came to be doing the work they do. So, what's a little bit about your background and why are you working at Planned Parenthood?
Yeah, so I became a registered nurse back in 2017, and then I pursued my career at graduate school to become a nurse practitioner. In the interim, I worked in an emergency department hold and observation unit in Binghamton while I was going to graduate school. And then I worked in the ER, the regular ER, for a year and a half after that as I graduated and became a nurse practitioner. And then that was in 2019. So I became a certified nurse practitioner and started my first job with Planned Parenthood as a provider. So going from that RN position to the NP position right at Planned Parenthood. And I just love providing medical care to our rural and underserved communities. And being able to give back and make a difference in the patients' lives is really fulfilling and why I do what I do.
Sure, and you're exactly right about underserved rural communities because we are living in the middle of a great big one, aren't we? So,
Yes, we are for sure.
So you're here to give us some information about the family planning and clinical services provided at Planned Parenthood. First and foremost, of course, are the birth control options available to people, both men and women. So let's look at some of those, please.
Yeah, absolutely. So there's good old birth control counseling. So if you ever just want to know what your options are, you can always schedule with us to just have a conversation. We'll go through all the many options that you're going to hear today and find the fit that works best for you. Now, I like to always give a caveat that sometimes it's a little bit of trial and error. So be patient. Sometimes we have to find the right method for you, but we'll get there. There's a lot of different options out there. So, first of all, there's things like the pill patch ring. Those are kind of the more common ones. Those have estrogen and progesterone only in them. So both hormones. And when people refer to the pill, that's what they're referring to as the combination pill most of the time. There's also what's commonly known as the mini pill, which is a progesterone only pill. If somebody can't have estrogen or doesn't want to have estrogen for a birth control option. There are LARCs, which are long-acting reversible contraceptive options, which we'll go into some more detail below with the process of how we place those and things, which we offer right at our health centers as well. But just hearing about them, those include the Nexplanon, which is a bar that goes right up here in your arm, as well as IUDs that go directly inside the uterus. And there's multiple different IUD options. Then there's the depot injection, which is a once every 3 month progesterone only method. Let's see here. Then there's non-hormonal options like external, internal condoms. There's spermicides. There's things like Phexxi, which are pH imbalancers. Um, Different things like that, and diaphragms. And then we also offer vasectomies for people with a penis that are looking for a birth control option.
So you have a lot of options for people, and as you say, taking the time to come in and have detailed conversations about this is really important because it isn't just a one size fits all sort of option, is it?
No, for sure. It's very patient individualized, and we can work with, past medical history, current medications, and your hopes and desires for what you want out of the birth control.
So, an important part of your clinic healthcare services is concerned with reproductive related healthcare. Talk to us about what you can offer along these lines, please, because when I was doing the research for this show, I thought I knew some stuff, but boy, there's a lot more here than I was aware of. So, you have a very complex set of services that you can offer.
We really do. And usually our patients are pleasantly surprised at the number of services that we offer. And we like to really advocate that we're here for you and we provide these services and come see us if you need them. So, some things that we offer are gestational dating ultrasounds. So, those are for people who are pregnant and hoping to continue the pregnancy. But as we know in this rural healthcare that we live in, it's usually a wait to get in with your OB provider after you find out that you're pregnant and you're waiting, 12 weeks, 15 weeks before that first ultrasound, which can also be very nerve-wracking and anxiety provoking. So we do offer gestational dating ultrasounds, which just tells you, hey, the pregnancy is inside the uterus where it should be. It's not hanging out anywhere dangerous. And this is how far along you are. Here's some pictures to take home, and you can bring your support person in for that first ultrasound to give you a little reassurance while you're waiting to get in with your OB. So we do offer that service for anybody looking for it. We offer STI and HIV screening, and as well as STI treatment, including syphilis treatment, gonorrhea, chlamydia, all of that good stuff we offer. And then if it's not something that we specifically offer, we get you referred in the right direction for HIV treatment, hepatitis C treatment. We get you in the right direction if we don't offer the service itself. We also offer cryotherapy for genital condyloma or genital warts, which is a freezing method to get rid of the genital warts, as well as prescription management options if you prefer to have prescriptions at home and do that on your own time. We do infection checks for people with vaginas to look for yeast, bacterial vaginosis, trichomonas, UTI evaluation and treatment, pelvic pain evaluations, which a lot of people suffer with pelvic pain and they think it's normal and it's not. So come on in and see us and figure out what's going on. Irregular and or heavy menstrual periods, painful periods, amenorrhea or loss of periods. That's not related to menopause. We do full workups for that. Pelvic inflammatory disease evaluation and treatment, PCOS, which is a big one, polycystic ovarian syndrome. Many patients come in not realizing that we do offer evaluation for that. And then if we are able to diagnose you with it, we do treat and provide a lot of management options. PMS and PMDD, evaluation and management, vulvar pain and vulvodynia evaluation and management, as well as ultrasounds for IUD localization. So we'll kind of go into that a little bit more when we talk about the procedures itself for the IUDs. But if you're ever concerned that your IUD might have moved, we can do an ultrasound to look inside your uterus and see if it's where it should be.
Well, there's a lot on that list, that's for sure. So, and
Yes.
I imagine many people think that your health services are mostly for young people, but in fact, you also help women manage the later stages of their reproductive life cycle. Can you tell us a little bit about what you offer along those lines, please?
Yeah, we offer both perimenopause and menopausal evaluation and management options. We have an entire menopause program, which is great, with a certified menopause director. So she took a bunch of courses through NAMI, and it's one of the certified menopause systems out there that provide the evidence-based practice to providing care for people in
Mhm.
menopause and perimenopausal state, and she's certified in it. So she is our program director for it, and we offer a lot of services for it. That service is just now starting to ramp up. People didn't know that we offered that service. They were waiting very long times to get in with OBGYNs who are just overrun right now. So if you're in perimenopause, menopause, or questioning if you're in those stages, come on in and see us and we can help you evaluate that as well as manage those unwanted symptoms like hot flashes and mood swings and things like that.
So, and that I'm sure is going to give a lot of comfort to people. And, you mentioned how hard it is to get into excuse me, OBGYNs. And of course, we've seen a lot of maternity practices close in rural areas because the hospitals don't want to support them anymore. So really, people don't have as many places to go as they used to, and that's what makes Planned Parenthood such an important healthcare service.
Well, thank you. We really appreciate that. And we do our best to provide the services that we know our community and our patients need.
So another important healthcare area that you are able to offer is to men. Let's talk about some of those services because that's probably not at the top of most guys' uh, agendas is I can go into Planned Parenthood because I've got a problem.
Absolutely. So, on top of the STI screening and treatment that we already talked about, we also offer a lot other of services for people with a penis. So, things like evaluation for epididymitis, which is a infection that can happen in the scrotum and the epididymi by the testes, which can be very painful. And can lead to a lot of complications if it's not managed. So come on in and see us if there's any kind of testicular pain, lumps, bumps, evaluations. Penile disorders like balanitis or urethritis, which are infections of either the skin or the urethritis of the urethra. Um, Vasectomy consultation. So that's the evaluation to decide, hey, I'm thinking about having a vasectomy, or I do want to proceed with a vasectomy. So we meet with you, go through the risks, benefits, what it means to have the procedure, and decide if that option is best for you. We do evaluation of testicular and scrotal masses. Anybody with a testicular scrotal mass, it should not be there, and make sure that you receive evaluation. So come on in and see us. We can get you in a lot sooner than a lot of other places. We'll get you referred for an ultrasound if needed. Sexual dysfunction evaluation and management, so things like erectile dysfunction, as well as arousal disorders, hyposexual desire disorders, orgasm disorders, and sexual pain disorders. And those disorders are also for people with a vagina as well. So if you're having any of those sexual issues, come on in and see us. A lot of people think that people can't help them with that, or medical providers don't know how to help patients with those issues, but we do. We have a whole bunch of guidelines to help us out and help you out with any of those issues you might have.
You know, when Crystal Collette, who is the CEO of Planned Parenthood up here, was in the studio last month, one of the points she made is that care can't wait. And that is particularly true if you have an infection, if you have a disease. Cancer screening is a big part of the work that Planned Parenthood clinics do. So let's take a look at some of those services, which you can offer to both men and women. And let's face it, it's not easy getting into a primary care office anymore, or as you mentioned before, OBGYN, because they are so busy. So you need to see somebody, come to Planned Parenthood is the message, right?
Absolutely. So not only can you book an appointment with us, but we also accept walk-ins. So if you're ever concerned, you have something come up that was unexpected, you notice a lump, bump, mass, something you're super concerned about, walk on in, and guess what? We're going to do our best to see you. And if not, get you scheduled within that week if we can. Okay. But some of the services that we do offer include breast cancer screening, breast concern evaluation. So outside of just breast cancer screening, so ordering routine screening mammograms starting at age 40 or sooner based on family history. We also evaluate any concerns you might have. So pain, lumps, bumps, new onset nipple discharge, new onset nipple inversion, any changes in the overlying skin. And that's for both males and females. So any people with a penis, if you notice anything suspicious in your breasts, although it is rare, it is extremely aggressive usually if there is any form of male breast cancer. So that applies for both males and females. Come in and see us with any breast concerns. Cervical cancer screenings. And then if cervical cancer screenings come back abnormal, we do colposcopies right at our health centers, which are biopsies of the cervix for further evaluation of how the cells are abnormal. Then if the colposcopy is abnormal, we do what's called a LEAP procedure, which is basically shaving off the abnormal cells on the cervix to help get rid of those abnormal cells. And we do that procedure right in our office as well, both at the Plattsburgh office and the Watertown office. So you don't have to go anywhere else for that. We also perform endometrial biopsies as needed for anybody that we're concerned for any endometrial cancers or abnormalities there.
So that's a very comprehensive list of services that you can actually offer. And there are not a whole lot of places that say we can come in, walk in, and we'll try to see you. So what's how quickly, if somebody does have to be scheduled, for example, in one of the offices, how quickly can that be accomplished?
So it really depends on our office and the week to week. Our bigger health centers, we usually book out a little bit further. So usually Watertown is probably the furthest out right now, probably 2 or 3 weeks. Sometimes you can get in a little sooner than that if they have some cancellations, things like that. Um, our smaller clinics are usually a little easier to get into. So Saranac Lake Malone, although they're only open certain days of the week. Same thing with Canton, Ogdensburg, only open certain days of the week. Plattsburgh office, usually within a week you can get in. Worst case scenario, 2 weeks. But again, we accept walk-in. So if it's something that you can't get an appointment for, you walk right in and see us.
That's an amazingly quick turnaround time, because so often when you need to see a specialist, it's a 6 month wait in order to get in. So, and as you point out, some things just can't wait. So
Yes.
that's good to hear that you can be so responsive to people in their time of need. So let's talk a little bit, Beth, about some of the other services that you can offer.
Yeah. So outside of what we call family planning services, which was all of that great stuff you just heard, which is a very generic umbrella for the majority of services, we also offer gender affirming care to our patients, as well as limited primary care services. High blood pressure management, basic diabetes management that's not insulin dependent. We also act as kind of like a bridge to get you into a full scope primary care, since we know it's so hard to get established with a primary care provider. So depending on the service, we might be able to help bridge your care until you're able to get in, send you some refills in the meantime, order some basic labs, and put in a hard referral to help kind of get you that appointment a little sooner than trying on your own.
One of the things that we are very rich in up here in the North Country and in the counties that Planned Parenthood covers are colleges. And college students come with a whole host of medical concerns and issues. So you can probably be a big help to them as well when they're so far away from home and their own family providers.
Absolutely. Absolutely. Come and see us. We'll help you out.
There you go. There you go. So you've offered us an incredibly comprehensive and exhaustive array of healthcare services that Planned Parenthood can provide. So let's talk about who can access those services and how to go about getting them.
Yeah, anybody can access our services. We do not turn away anyone. So come in and see us. If there's something going on that we can't specifically help you out with, we're going to put in referrals. We have a follow-up team that will help coordinate things for you, so you're not left to the wind to try to figure out how to get in with these specialists. We send anything that we need to the specialist we're trying to get you into, and our follow-up team helps facilitate that with you, so you're not on your own. Same thing with any prior authorizations that are needed. We have a team that helps facilitate that for you. So anybody can come see us at any time, and we'll either provide the care for you or get you pointed in the right direction. You can do that by scheduling online, so visiting plannedparenthood.org, and selecting any of our health centers that are closest to you. So pick the health center that's closest to you, and then you can schedule right online, or you can call us at 518-561-4430 and schedule with somebody via the phone. Or you can walk right into one of our health centers and see if we can either take you as a walk-in right then and there, or you can schedule with one of our front desk employees to schedule at a later date for your appointment.
So Beth, I want to ask you a question, because healthcare has been so much in the news lately, especially with the federal government shutdown and the pulling back of Medicaid funding and things like that. Your Planned Parenthood clinic has an you're still offering full services to your Medicaid patients, even though the reimbursement is so much up in the air. So let's talk about that, because that is such a critical of importance to so many people in this part of the state and in all of rural America for that matter.
Absolutely. So we are still accepting all Medicaid patients. Come in and see us. We are not worried about, we are worried, of course, we are worried about the reimbursement, but we are not worried about providing your care. So come in and see us. We are not turning away anyone with Medicaid, and we are not forcing you to be self-pay because of it at all. So come in and see us for the health care that you need, and we will get you taken care of, regardless of what reimbursement is happening.
And that is so important because healthcare is not something that you can just ignore and wait for a new administration or whatever we're going to have before things get straightened out again. So the fact that you are so open and so welcoming has got to be a huge relief to so many people who are frankly worried about where their next meal is coming from, let alone where their next doctor visit is coming from. So these are really tough times for people, and having this kind of on demand care from people who know what they're doing and who really care is very important, isn't it?
It really, really, really is, especially in our rural community where there's not many options as well. So healthcare is so important, so underserved, and you are your best advocate. So if something's going on, come in and see us, and we'll get you pointed in the right direction. We also offer telehealth services, so just
Mhm.
throwing that out there as well. If you're unable to travel or something has come up so you can't get in with us, as long as you can have some kind of video access, we can meet with you virtually and have an appointment that way for most appointments.
And that's a really important option for a lot of people because we know transportation is one of the huge barriers across our very large region where there are far more trees and cows than people.
Exactly.
So,
Exactly.
well, any final thoughts, Beth, as we start to wrap up here? Would you like to leave in people's minds about what Planned Parenthood can offer them in these two important areas?
Yeah, so I want to thank you again for having me today. This has been super helpful and getting the message out on the services that we offer. But just know that as much as I tried to make this a comprehensive list, I'm sure I left a few services off this list that you heard today. So if you're at all in doubt and you're thinking, "Ah, I'm having this issue, where am I going to go? I can't get in for 6 months." Come see us. And like I said, even if we can't help you out specifically that day, we will facilitate care for you. We will get you where you need to go. We have a lot of services available, grants available to help. So please come and see us if in doubt and utilize telehealth whenever you need us. As long as you're inside New York State, you can use us for telehealth. You don't even need to be in our immediate region. As long as you're in the state, you can utilize that telehealth service. So please, please come see us. We're here for you and we care.
Yeah, and it's very obvious that you are there for people and that you care and that you are welcoming and you will do your very best to help them with whatever their medical question or their issue is. So thank you so much for coming in. I'd love to have you back for another show. I know there are other things that we can talk about. This is part of an ongoing series that we're doing with Planned Parenthood because you offer such essential service and you cover so many areas where we are underserved. And so what is happening up here is no different than is happening in lots of rural places across the country, but we have Planned Parenthood to fall back on. So thank you, Beth, for your work and for being such a great support network for our North Country folk.
Thank you. I really appreciate those kind words and I appreciate your time. I'd love to do another show with you and tell you all about everything else we offer.
All right, well, we'll book it. Don't worry, we'll book it. So thanks again, Beth.
Thank you.
These conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, not only does our North Country matter, but your health care matters too. And that's what Planned Parenthood is here to do to offer to folks. Make sure you call them if you need them.